thank you and good morning. I was hoping we would hear the starting quarterback for the 49ers, but it is me. But good win last night for the Niners. We're back on track. Well, thank you all very much for being here. It's really exciting. Thank you to Larry for another incredible conference and your great energy and leadership, and I know we'll all get a lot out of today. What I'd like to briefly do in my opening remarks is talk a little bit about not only how this meeting is moving into the cloud, but how is our healthcare moving into the cloud? And what are we doing right here at Stanford to deliver care through the Stanford Health Cloud? Now at Stanford, we start with this broad strategy of saying, how do we deliver both leading edge care and highly coordinated care? And any of us who've been in the healthcare arena, and I know we have a lot of patients here, I think you'd probably say healthcare writ large is not very coordinated. There's some outstanding clinicians, there's outstanding technologies, but often the patient has to own the complexity of care. What if we own the complexity of care? And that's what we mean by creating the leading edge and then delivering it in a highly coordinated fashion. Like these great devices that you're all working on up here and tweeting on, they're pretty sophisticated devices, but the interface is pretty simple. I bet most of us never read an instruction manual on how to use those. That's what we're trying to do here at Stanford. Leading edge and highly coordinated care. And we're doing that through a few key strategic domains. So we do a lot of complex care, very tertiary care. And so as we design new buildings, we're trying to co-locate services. So we have a new neuroscience center, for example, opening up. We have neurology, neurosurgery, neuroimaging, neurodiagnostics, neurorehab, neuropsychologists, all in one building. One call or one click gets you an appointment that's a multidisciplinary coordinated appointment. Imaging, testing, multiple physicians and clinicians reviewing the case. That's the goal in complex care. But many of us don't have complex conditions. We have maybe more routine care. So to that end, we're thinking of our network of care. And just like we saw those great diagrams of the nodes of the network, how do we deliver a network? Through growing our faculty, through community affiliations, through contracting affiliations, and through virtual affiliations. And most of us in this room hope we don't have to interact with the healthcare system or proactively interact. What if we were accountable for the care? What if we had your genome sequenced here at Stanford, and in 1 and 2 and 3 years, we'd call you? So for example, on the left here, you see a dashboard. This is a population health dashboard that we use in our ambulatory intensive care unit. This is an outpatient clinic for patients who have multiple chronic comorbidities. And we don't wait for the patients to come in. We're tracking their measures. And when we see something that we don't think looks good, we call them. And we're also starting to not only do population care, but precision care. So we're also sequencing the genome of patients and saying, you know, Amir, there's a few things in your genome that I think are troubling. Why don't you come in and let's talk about those things? And finally, we're putting that into a benefits package. Our Stanford Healthcare Alliance, which rolls out next year, is a accountable care organization, a health plan, a health benefit plan, if you will, where patients enroll in this plan and we look after their well-being and try to not only personalize and partner with them on their care, but try to predict and prevent what might happen and prevent it from happening in the future. And finally, how do we truly make care virtual? How do we put it in the cloud? So at Stanford, we've launched our Stanford Health Cloud, where we use a number of key components. Clinical brain, we have great people, but increasingly we need analytics, just like we heard this morning already. How do we use clinical intelligence? And we have a number of people in this room and some affiliated companies where we're using analytics, using natural language processing to look at our calls to our cancer center and see if there's anything in those notes that's particularly troubling. Which patients are most likely to get readmitted? We're looking at that. Patients with coronary disease, who's most likely to have complexity down the line? So how do we use analytics and intelligence? And finally, how do we help patients navigate this system? And we're doing this through our online portal, or Stanford My Health. We have over 100,000 patients connect online today. We have corporate affiliations. We have Qualcomm here today, where we have an on-site clinic in San Diego, and then we do virtual care, telemedicine, telepsychiatry, teletravel clinics, teledermatology. Navigation services. We have a 24/7 international hotline. Any patient from any of these, or any employee from any of these companies can call us anywhere in the world, on any question they have. A third of our calls are international, patients traveling from Silicon Valley to the Far East and elsewhere. And finally, how do we directly connect with patients? Through our Stanford eCare services. And let me close with a little video here to show you our eCare services.
Connection matters. It's at the core of everything we do. But what about your health? Introducing eCare from Stanford Hospital and Clinics. eCare connects you to your doctors and your doctors to each other.
I'm looking at the patient's record now. I suspect gut tape psoriasis.
She can come in to start therapy in the next few days.
Making Stanford expertise accessible anywhere you are.
Should I be worried?
No, we can set up treatment within a week. I'm sending you a link so that you can schedule an appointment online.
Thanks, Dr. Boyd.
eCare. Complex care made simple. Brought to you by Stanford Hospital and Clinics.
So welcome, and I look forward to engaging in a great conference over the next several days. Thank you so much.